Yeah.
Okay, it's done.
Okay, so, all right.
Respiratory.
Yeah, so let's just keep moving straight through to the respiratory section. Okay, again, I want to draw attention to the drainage of the abscess or hematoma. So we're in the nose, code 30,000 even. So it's drainage, abscess, or hematoma, nasal, internal approach. So again, it's talked to reinforce that you're going to have the same, a lot of these procedures are the same in terms of drainage of abscesses. You can have them in multiple different systems. Watch what system you're in because that'll lead you to the right code.
How that piece.
Okay. Let's see if there's anything. Okay. Both the NCCI, right below code 31,230, it talks about the endoscopy of the accessory sinuses. Both the NCCI and the book talk about this. A surgical sinus endoscopy includes sinusotomy when appropriate and diagnostic endoscopy. They also talk about the fact that the code range mentioned that for the dilation of the sinus ostia include the fluoroscopy. And when we get to those actual codes, it will get the 31295. 1295. It actually did not remind you. Okay. Just be aware that when you're taking the test, be aware to look back until you get to those, just in case they have additional instruction. Because when you get to the 31295 to the 31297, it does not tell you not to report the guidance. It only tells you that. Okay.
All right. Cállate y vos, si vos.
No, barriga esa, no.
Es lo que dice, no digas.
Deja tocar la ventana con el culo y no mete la barriga.
¿Qué barriga? ¿Ese barriga que tú tienes?
Sí, sorry.
¿Quieres agua?
No, that's.
Yes, you want water?
I've got a little water left. With all of the, and I'll repeat this, with all of the
Un
endoscopic,
poquito.
with all of the endoscopic procedures in here, they warn you to warn you to watch the anatomic site examined. And they say a laryngoscopy includes the examination of the tongue base, the larynx, and the hypopharynx. So whenever you're doing, if you get a question on an endoscopic procedure, be sure to look back up to the the description of what the
Como
endoscope
enseñado.
Endoscopy.
endoscopy includes. Um,
See, for each anatomic site examined.
It has to justify like a respiratory treatment.
Un capítulo completo de guía. Mira, protocolo. Ve que es complicado.
¿Qué son preguntas? Ah, eso lo dio él. Yo
¿Cuándo lo vio eso? Yo
¿Tenemos razón?
no sé cuándo lo vio. Yo lo tengo, mira.
Bueno, fotocopiar.
No,
Bien.
me salgan fotos.
lo tenés.
Falta
Porque parece que
Ah, no tengo.
problema tuyo.
I do want to draw your attention to just after code 31899.
21999.
Yep. Just after that, they talk about the lungs and the pleura. I would be sure to,
318.
99.
99.
Oh, this is the procedure, track and branch.
Ah, okay.
Yeah. But after that, they talk about the lungs and the pleura. I would definitely mark stuff in here.
Okay.
Let's see. And this is just simply, as a coder, I don't know these things. About halfway through the first paragraph, it has a statement saying, however, a diagnostic biopsy of a lung nodule using wedge technique requires only that the tissue sample be obtained without particular attention to resection margins. Versus, the verses was me editorializing. A therapeutic wedge resection requires attention to margins and complete resection even when the wedge resection is ultimately followed by a more extensive resection. In the case of a wedge resection, so I would probably put a highlight the however and highlight at the end to let me know to read that part of that.
Until here?
Yeah.
Okay.
So I would just do the first and last, so that that would remind me that this is far more complicated. The wedge resections what are more complicated based on the whether it's for therapeutic or diagnostic purposes.
A ver, no sé qué usar para ¿Qué pasó con esto? ¿Cuándo lo usan?
Esto es cuando voy a hacer otro proceso que no está incluido.
Que no hay ninguna. A la diagnosis biológica.
En Q. Nosotros somos una abeja. Tenemos una abeja.
Voy a poner esto de datos de ahora. Lo importante es la resección de las manos.
Tendrían que revisarlo 2 o 3 veces para saber qué es lo que podemos hacer.
Estoy leyendo Modify, no sea de con su set de modificador que es lo que el otro. Lo que pasa es decir, es nueva nota, es algo más. Es decir, que tiene mucho conocimiento, pero no sabe cómo explicarlo. No tiene que.
Dicen casos de que es lo que es la introducción a la parte de acá.
Lo específico debería saberse para cada año.
So under the section we're looking at of the lungs and the pleura, the other thing I might highlight
Ah, ya.
is, it says in the last,
Ellos ya.
In the back?
right before it starts the code, right before there, in the last paragraph, it says when a diagnostic wedge resection is followed by a more extensive procedure in the same anatomical location, report add-on codes 32507 or 32668 with the more extensive procedure. So it tells you how to report the wedge resections on the same anatomical site and also on different loads.
Different low.
In the modified 59.
Club.
Yo creo que me van a meter este libro como pintura así.
We were talking about,
The lungs are
if you go to code 31899, underneath that they talk about the lungs and pleura. About halfway down the first paragraph, it starts out, it says, however, there'll be a sentence that starts here. However, yeah. I would highlight that until the end of, or not highlight the entire thing, but just note that, yeah, that last part of the paragraph is, for me as a non-clinician, I would need to know that. And also, the same thing with the last paragraph, the last half of that.
Right here?
Yeah.
Starting when a diagnostic
Right.
Wedge resection.
From appointment.
Let's see. I don't think anything's gonna be on there about lung transplantation. I mean, that's just too much. But they do have information on it. Okay. The pulmonary section, respiratory section is fairly easy to code because it's straightforward in terms of what's being done. And there aren't many exceptions. The cardiovascular system is very difficult to fill. And if you flip through it, you'll notice there are lots of notes and lots of stuff in green. it is, it really does take up the majority of the 30,000 code range. So, all right.
Había más hasta las 9.
No, el reloj va a ser otro.
No pregunta mucho esto. Cateterizaciones, implantes de marcapaso. Neuro no parece
Y este,
They give you kind of a cheat sheet on page 187 for when you're doing pacemakers or implantable defibrillators. There are certain things you need to look for. The most obvious one is how many leads. How many leads will it have? So, but my advice on this is just with this, be careful of, let's see. Be careful of the number of leads, be careful that it's the initial insertion. Versus replacement or conversion. And like I said, I mean, the test makes this easier because they give you the codes to look at and read. And so you'll be able to compare the number of leads on it versus, and also you compare the number of leads with what's in the code to what's in the report, and also compare whether it's repair or initial insertion. When I do the homework this time, just simply because this is complicated, I will have probably 3 or 4 questions on pacemakers. There's a lot that's actually included in the service. So one of the things I would do is I would be sure, because I'm not sure what you're going to find important in this basically 2.5 pages of information. If I were you, I might do a cheat sheet, or not a cheat sheet, but if they have an extra tab, I would tab this little cheat sheet and label it pacemaker or something like that.
Gracias.
pero con los tuyos.
Se acabaron.
verdad difícil de arrancar.
Mira el cuadrito.
I probably will also, code 33510,
335. 335.
okay. I want to draw your attention to these codes, because if you read the paragraph, read the instructions above it. The following codes are used to report coronary artery bypass procedures using venous grafts only. These codes should not be used to report performance of coronary artery bypass grafts using arterial grafts and venous grafts during the same procedure. It also tells you that getting the saphenous vein graft is included in the description of the work for the grafting and should not be reported as a separate or co-surgery. However, the upper extremity vein may be reported. So it's just the saphenous vein. Others can be reported with it. So you will probably see in the homework from me, because cabbages, and I'll tell you where the grafts come from. Because coronary artery bypass, vein only, and then you've got single, you've got 2 coronary grafts, 3, 4, 5, and 6. And then you've got the ones that are both venous and arterial. Okay. And then you have just the arterial bypass grafts. So probably you can expect 1 or 2 questions on the homework about that. And it's just to practice paying attention to the minutia that is coding. And this is all about just that.
Una costura.
Dale, tú estás bien, el libro se compró.
Yo le quiero meterle un cubo más de pintura amarilla.
Dale, yo voy a comprar tu aquí, nada.
Y gato eso no lo sé.
Es que es un vaso de
No,
grasa.
no, pero si tú lo haces.
Cándido
Mi
presenta.
esposa, que ya es me prestó el libro de ella, mi esposa lo marcó. Sale un libro así.
Cándido preserva una obra en tu casa.
Sí, pero
Tienes que pagar.
Cándido, comparte en tu momento.
Memoria América.
I will probably, we have new codes this year for starting with 33946.
33946.
Está corporeal membrane cyanation.
So, okay, there will probably, I have to go back and reread this section. Basically, I'll reread the section. There will be there will be a question on this. Because there probably will be, I'll probably put 2 or 3 questions on this, simply because there will be probably a question on the test. I would draw your attention to the second paragraph.
What page, please?
Sorry, page 205. It
Okay.
says services directly related to the cannulation, initiation, management, and discontinuation of these services are distinct from the daily overall management of the patient. The daily overall management of the patient is a factor that will vary greatly depending on the patient's age, disease process, and condition. Daily overall management of the patient may be separately reported using the relevant hospital observation, inpatient, or critical care evaluation and management codes. Do I want to really mess with you? Because I haven't taught E&M, you all will get a pass on the question that I do. Because you've had E&M,
Without you, we had.
you won't get a pass on that.
No, no way about Candio. Candio maybe know about that more than you.
Yeah.
He's studying.
I got it, sir.
Do that book. He analyzed, replace,
But it's
channel.
Yes, everything. I will read everything. I'm the best.
The best.
Some friend gave me his book, and I marked in my book for it. And I don't read nothing of it.
but part of this will be getting the correct modifier on it. Because it'll be both the E&M and ECMO service. Okay. We have cardiac arrests. Okay. That was pretty straightforward. I will probably have, okay. So when you get to 34,001, we start to get into what is the real pain of the cardiovascular system. Because for a non-coder, this is for a non-physician coder, this is one of the hardest topics to get right. Like when we were talking about the diagnostic imaging and stuff in the radiology section, one of the things I explained is that as physicians, I can point to an area and you can tell me the veins and arteries that run through there, just off the top of your heads. It's just part of your knowledge, and it's so ingrained in you. A coder cannot do that. So for us to know where the point of insertion is, the catheter goes up to the vena cava or the aorta, then it snakes around and does, a thrombectomy of the radial artery. Well, that was by arm incision. So So these are kind of direct, but when you start talking about, the placement of catheters and stents, and balloon,
Pero va a vivir 150 años.
¿Eh?
Va a vivir 150 años.
opening the vessel with a balloon, I forgot the terminology for it. But when you start talking about placing all of that, each time the catheter moves into a new branch or a new family, you put another code on there for the catheter placement. So imagine exploring from here down. And having, you go up through femoral, and then explore from here, or here and down. How many branches, how many families there are? And every time you get to a terminal end, that's your code. And then you come back, and new family, new terminal end. So for a non-physician to keep track of all of that, becomes very difficult. That's more the specialist exam. If there's some, I'll ask one or two questions in the homework on this, and they'll be very direct, because the test will be very direct on this subject, simply because it's not the specialist exam. It just wants to make sure you know how to do, you know that for every time you come to the end of a branch, end of a family, and go into a new one, you need new codes. So I will ask about that. Angioplasty, balloon angioplasty.
Hablando de ahí, tenemos el coco.
I know, man.
No, preocúpate, vamos a sacarle la agua.